I know what you're thinking. C-spine X-rays are so complicated. Here's a quick overview of the basics and some common pathologies too. In South Africa, cervical spine injuries are incredibly common. Cervical spine injuries are important as they can result in death or lifelong neurological defects if not treated properly. Who should have C-spine imaging? High-energy trauma or low-energy trauma with any of these features. A CT scan or MRI may be warranted in these patients, especially if there are unclear X-ray findings or limited clinical examination. The clinical picture should always be considered in the context of a C-spine X-ray. Remember, it's all about being a safe doctor. Interpreting a C-spine X-ray is as easy as an orthopod's workout. There are 3 views of the cervical spine. Lateral view, AP view, odontoid peg view. To interpret the cervical X-ray, you should use a systematic approach. Make sure you assess all the visible structures. Use the ABCDEs approach. A. Adequate coverage. A. Alignment. B. Bodies. C. Cortical outlines. D. Disc spacing. E. Edges and soft tissue. The following rules apply to the interpretation and presentation of all X-rays. Always confirm the patient's identity and date of birth. Then identify the type of X-ray and the specific view that you are looking at. Be sure to orientate yourself. There will usually be a small metal marker indicating either the right or left of the X-ray. Adequate coverage. Ensure that all vertebrae from the skull till T1 are visible. If T1 is absent, a swimmer's view should be requested. Alignment. The anterior line is formed by the anterior longitudinal ligament. Draw this by joining the anterior portion of the vertebral bodies, and this should form a smooth, continuous curve anteriorly. The posterior line is formed by the posterior longitudinal ligament and is drawn joining the posterior borders of each vertebral body. The spinolaminar line is formed by the anterior edges of the spinous processes and is particularly important for subluxation of the vertebra. The cervical cord lies between the posterior line and the spinolaminar line. Check that all vertebral bodies are approximately the same height. Shortening of a body may indicate a compression fracture. C1 does not have a body. Check that all bodies correspond to a spinous process. Cortical outlines. Trace out the cortices of all bones looking for fractures.
Created using Powtoon.